Next up, we have Lindsay Scruggs with Molina. Lindsay is based in beautiful Miami, Florida, and has been with Molina for 3 years. She has spent the majority of her 15-year career on the carrier side, but she has also sold directly to customers as an agent. And I'm sure she's got some exciting updates and opportunities to share with us for 2025. Lindsay, if you are mic'd up and ready to go, you can open up and I'll pass the mic over to you, as it were.
Great. Thank you so much. Good morning to everyone, and thank you for joining. Again, my name is Lindsay Scruggs. I'm the Marketplace Sales Manager here for Molina, and I'm very excited to talk to you guys today about what we have going on. Took a peek at some of the rates. It looks like we're going to have a lot of opportunity, so let's get into it. Uh, just recapping our open enrollment period for the states we're going to be discussing starting is November 1st, running through 2024, running through January 15th, 2025. Okay, a little background about Molina. So Molina is a Fortune 500 company. We are ranked 125th, and Molina, as of March 31st, 2024, we serve approximately 5.7 million members across 21 states. So next, I'd like to take a look at our national footprint. Here you'll see our existing states in the light teal, and then we do have some expansion in four of our states: Florida, Texas, Kentucky, and Ohio. So let's take a look at the details. First up is going to be the states with expansion. Is going to be first going over Florida. Lots of exciting things happening in Florida. So we do have expansion into 5 new counties. Up in the Jacksonville area, we've expanded into Baker and Bradford. We've also expanded in the center part of the state to Hardy, DeSoto, and Hendry counties, and then maintaining that existing footprint in all of the other counties. I will let you guys know I did some shopping this morning. Rates are looking really good. Number one in bronze in Miami-Dade, Palm Beach. We have $0 bronzes in Broward. I saw some as well up in the north with Duval, Clay counties, and that's just what I've looked at today. So I think we're going to be very competitive in Florida. What's really exciting for Florida that I just want to mention, we got rid of referrals. There are no more referrals needed in Florida to go see a specialist. Very big deal for Florida. We think this is going to be a big year for us. Rates are looking good, and we do have the no more referrals. So let's go into Ohio. Ohio is another state we're going to see a lot of opportunity. We've expanded into 15 new counties. We've really expanded our presence in the state and filled it out. We're almost in every county. We're going to see some opportunity, definitely in Ohio. We rolled out a bronze plan. I'm going to go over that in some later slides, but definitely in the South, I think in the Cincinnati area, Columbus, and then up in Cuyahoga where Cleveland is. So definitely some opportunity for Ohio with the expansion. So let's go into the next state with expansion, which is going to be Texas. Texas is finally in play for us this year. Really excited about Texas. We've strategically expanded along the border. You could see there in the south, and then we've enhanced our network as well in the Dallas Fort Worth area. Lots of good things happening in Texas with our expansion. We also have a considerable amount of off exchange plans, what I'm going to talk about later in the slides to come. So lots of opportunity. We're looking pretty competitive as well in Texas as well. So let's go into the next state. And these are going to be states without expansion. So first up is Illinois. Opportunity in Illinois is really going to be Cook County. That is where uh, Chicago is located, for those who are not familiar. No expansion here, just maintaining that existing footprint there. Next, we're going to go over Michigan. Again, maintaining that existing footprint in Michigan. I think Michigan is going to have some really good opportunities for us as well. And then just a note, if anyone is fluent in Arabic, Michigan has a large Arabic population that is underserved. So if anybody is speaking Arabic in Michigan, is definitely go target that state. Okay, so let's go into next, which is going to be Mississippi. Footprint there, again, no changes. We're in all counties. Mississippi is going to have some definite opportunity for us. In the Biloxi area in the south, that's in Harrison County, and then in Jackson up in Hinds County. Definitely going to be some opportunity there. We also had some network enhancements. We added St. Dominic's along with Oshner, so we've really strong network in Mississippi. Uh, Half of that business in that state is written without an agent. The reason that is I've been there several times. The way of doing business, most of those agents are a little bit antiquated and they like to sit down face to face with those agents, or excuse me, with those members. And unfortunately, they're just not able to service everyone with that business model. So a lot of opportunity in Mississippi. Next, we're going to go over South Carolina. So South Carolina, again, another state, we're maintaining the existing footprint. We're in 45 of the 46 counties. Something that I want to note about South Carolina, we have two populations we serve pretty well there with our drug formulary, and that is members who have HIV, as well as there's a pretty significant population of members who have are on methadone treatment. Molina has what I would call the least path of resistance for them to get those medications compared to some of our competitors. So when you get a member with either of those conditions, please make sure you do think of us. Again, our drug formulary strongly supports the needs of those members. Next, we're going to discuss Utah. So Utah has some interesting things happening in the state. Again, our footprint's maintaining in those 13 counties. We're likely going to see some opportunity in the south in St. George, which is Washington County. And I just want to put a little bit of color to what's happening in that state. So on the next slide that I'm going to show you guys, we're going to look at what the competitive landscape is looking like there. First up, Molina's taking, just under a 5% increase. But when you look at our competitors, we are considerably lower. Um, if you look at Select Health, they have the majority of the membership in the state. They're getting over a 9% increase. And then looking at Regence Blue Cross Blue Shield, the second carrier with the largest membership, they're taking close to a 20% increase. I would say more than likely those members are going to be shopping and looking for a new option. We feel we will be a great fit from our price standpoint in Utah. Also in Utah, we have a very good provider network. So on the next slide, what I'm going to show you is just some of our key major provider groups there: Intermountain Healthcare, Mountain Star, Steward Healthcare, and University of Utah. So lots of opportunity in those states. Next, I'm going to go over some member resources. These are going to be benefits and tools available to our members, such as the Molina Healthy Rewards. This is formerly known as My Health Perks. This is our $200 wellness incentive program. Members, all they have to do is complete their annual wellness checkup with their PCP. They go into the My Molina portal and complete their Molina wellness assessment, and they will be eligible for that $200 gift card. We have over 200 vendors to choose from. The gift card comes in $50 increments, which allows the member to split it up between multiple vendors. We did also add Visa gift card this year. So if a member did want to go ahead and get that Visa gift card and then pay their premium, they could do that. Another benefit to our members is going to be our RX savings solution. This is a service that helps members maximize their prescription benefits and lower their out-of-pocket cost. They'll get an email on how to access the tool. It gives them an introduction to the benefit, guidance on how the benefit to activate it, Please make sure that they know they do have to activate the benefit to utilize it. They can also call RX Saving Solutions at the 800 number listed here. So I'm going to take about 30 to 60 seconds to go over this page. I strongly encourage that every single person do this at the time of enrollment with their member. This is going to cut down on your servicing time so that you can focus on selling. And as we know, we don't make our money servicing. We're salespeople. We have our My Molina member portal and the mobile app. So they can download the mobile app right on their phone. They'll have access to their ID cards. And then there's the Molina e-portal. This is their member self-service. They'll be able to do everything from find a doctor, look at their member handbook, any kind of member forms, ID cards. They also have the ability here to complete that wellness assessment that we just discussed about the 2 slides ago about the wellness, excuse me, long day. That's also where they go to complete their Molina wellness assessment to get that $200 gift card. Next is we do have dedicated member resource phone numbers for every state, so please make note of those if your members do need assistance. Next, I'm going to go over payment options. We have quite a few. So first up is auto pay, everybody's favorite, right? You set it, you forget it, and it processes every month. They could sign up through that at mymolina.com. They can do an online bill payment. So this is where they go to their bank's website, pay the Molina Healthcare through the bill pay option. They'll use their subscriber ID as the account number. They can make a payment by phone. We accept Visa, MasterCard, Discover, or electronic check. We do have dedicated enrollment and premium billing phone numbers, which will be on the next page. They can send a payment by mail. Please make sure that they include the payment coupon provided in the invoice notice and that they are allowing for 10 to 15 days for mailing and processing. They'll send it to that Molina Healthcare PO box listed here. Next is this is a great option for those members who do not have a bank account or a credit card. We have MoneyGram that accepts cash payments. They can find a location by calling the 800 number or visiting moneygram.com. This year, we also added check free pay. This is another in-person cash payment option for those members without bank accounts or credit cards, or maybe they just feel more comfortable doing it this way. They can go to over 30,000 payment sites inside popular stores to make that payment. All they need is a bill stub or their subscriber ID, and then click on the payment center locator to look up a payment site closest. We have one-time payment option, and this is through the web payment bill matrix link here. You can do Google Pay and Apple Pay. So again, a variety of different options for all those members to make the payments. As I mentioned, these are the dedicated enrollment and premium billing numbers for each respective state, so please make note of those. Okay, let's get into some benefit information. What's happening that's new? First is our value basics. This is going to include some benefits such as the 24/7 telehealth services. This is through Teledoc. It does include mental health. We have no cost on preventative prescription drugs, preventative screenings for children and adults, pediatric vision services, RX Saving Solutions, the 24/7 nurse advice line, and then again that Molina Healthy Rewards wellness program with the $200 incentive. This is a high-level overview of all of our plans by state. I would strongly encourage if you're selling in multiple states, this would be one of the parts of the presentation I would print out and have readily available on my desk just for quick referencing. So let's go into the different plan options. First up is our bronze portfolio. Bronze is available in Florida, Mississippi, and now Ohio. In Florida and Mississippi, we did retain that Bronze 4, that is probably our most popular plan. So far, I have seen that we are #1 in several counties in Florida. I haven't gotten to Mississippi yet, but several already. We're looking like we're #1 on that Bronze 4, $0 Bronze 4. This has a $0 medical deductible. It's probably our most popular plan. We expect we're going to see a lot of membership here. It has some really good benefits for our members. And this is in Florida and Mississippi only. The Bronze 9, this is in one of the new plans. It's in Ohio, excluding Franklin County. So this is a Molina mid-deductible option. And this plan is expected to attract members with conditions that exceed their max out-of-pockets. So that's what we want to think of is going to be a good fit for those folks in Ohio. And then the Bronze 10, this is the low deductible option and 50% co-insurance. And this is going to be aimed at towards the low to medium level utilizers. Then, of course, we do have the standard Bronze. This would be available in Florida, Mississippi, and Ohio, again, excluding Franklin County. And CMS designed this pretty consistent with the cost share structure from 2024. CMS only made minor updates to the plan design. So next, what we're going to go over is the Silver plans. Silver also looking very competitive so far. Again, I've only started window shopping Florida, but it does look like Florida, we're #1 in several states already. Excuse me, several counties already with that Silver. I believe I saw look like Bradford County, #1 in Silver, Baker County, #1 in Silver, DeSoto, Duval. So we're going to have a lot of opportunities with this Silver plan. We kept our Silver 1. This is intended to be the buy-up option for consumers over that Silver 12. Gives them a little bit more option with the co-payment cost sharing. And then it's got a lower medical deductible and max out of pocket. We have our Silver 9. Silver 9 is only available in Miami-Dade and Broward. This is our tiered hospital plan. Please make sure that any member you put on this plan, you are educating them on how the plan works so that they know when they go to a choice facility, it will be a lower out-of-pocket cost to them versus going to a select facility. Members can refer to the online provider directory for facility designations. It will say whether it's a choice or select facility. Again, please make sure any member on this plan is aware of that benefit and how it works. Next is that Silver 12. We introduced this past year. This has the 4 free primary care visits. This is intended to be a low-cost option for consumers. It maintains a lot of member-friendly cost share features such as copays for PCPs, specialists, urgent care, and preferred generic drugs. And I just want to note the Silver 12 is not available in Miami-Dade and Broward County, and that is because we have the Silver 9. We also have the standard Silver. CMS has proposed pretty consistent cost share from the 2024 design, only minor changes to the plan. Next, we're going to go over the Gold portfolio. And again, new options happening in Texas. We do have that new Gold 12 plan that's going to be in Texas. We do also have, again, our Gold 1 plan. This is designed to be the consumer-friendly option. It's got the low cost shares on primary care, specialists, urgent care. Pretty consistent plan design from 2024. We only have some minor changes to the preferred generic prescription drugs. Again, we have that Gold 12. This is the new one that I just mentioned that's now available in Texas. This is an additional option in the competitive gold market, and it's designed specifically as an alternative design to our competitors. And it offers that low generic prescription drug costs. And then we do have that CMS Design 2025 standardized gold plan, very similar to the 2024 design. CMS only made minor changes to the plan design. Just want to recap about the Teladoc for anyone that isn't familiar with it. Teladoc is the virtual care services that members can utilize right from their phone or a tablet. They have the ability to treat symptoms such as cold, flus, allergies, sinus problem. All of those are available via the Teladoc. They have unlimited visits. It's 24/7, 365, and we do now offer the mental health benefit through the Teladoc services. Next, we're going to discuss some adult vision plans. These are available for adults who purchase the Silver One or the Gold One plan with the adult routine vision services. They're offered through VSP. VSP has one of the largest networks nationwide. This is available for members age 19 and older. They get the comprehensive vision exam, routine retinal screening, lenses, and this is limited one pair per calendar year, up to $150 allowance. Prescription contact lenses, this would be in lieu of prescription glasses. Materials and services are limited one pair of contact lenses, up to $150 per calendar year. Members can go to vsp.com to find a list of doctors, or you can call the 844 number listed here. Okay, not to backtrack a little bit, but I did want to just go into our off exchange plans a little bit more. So let's discuss those. First off, what is off exchange? For anyone that is not familiar, the term off exchange plan, it describes a health insurance policy that a potential member can buy from an insurance carrier or a licensed broker outside of the official state or federal ACA marketplace. It's often purchased by potential members who don't qualify for those tax credits. And then the off exchange plans also do not offer cost sharing reduction plans. So let's look at Texas, what we're offering here. This is all of our plan names with the corresponding QHP IDs. As you can see, we're offering several plan options. So let's just take a look at what those plans are. What you're going to notice is that our plans, our off exchange plans, are mirroring the on exchange plans. So you're going to see a lot of similarities between our off exchange and our on exchange plans. I'm not going to bore you guys with all the benefits, but please just take a note. They are very similar. So when you're looking at those off exchange plans. And then also, I did want to mention our Silver 3. We've moved it from on exchange to off exchange, and now it will just be offered as the Silver 3. So how do you write an off exchange plan? Through Health Sherpa, you can access it. You'll go to the agent dashboard. You'll click the drop down button in the right hand corner and click the off exchange. If your client is eligible, make sure they add their ICRA or cafeteria amounts when quoting. They'll be applied to the premium prices, meaning that the plan list will reflect the portion of the premium the applicant will need to pay. After choosing an off exchange plan, you'll be directed to complete an application for off exchange enrollment. Easy peasy. So next, let's look up how to find an in-network provider. We have our seamless digital friendly experience for everybody. This has our members and brokers alike can go to this. It's at molinamarketplace.com. You'll select find a doctor from the member drop-down list. Here you can search for providers by name, specialty, geographical location. It also gives members the ability to search by if they have a language preference or if there was a gender preference as well. And then for those members that are the primary subscriber, when they're in the provider online directory, they have the ability to update their PCP self-selection right there. That's again only for the primary subscribers. Otherwise, you would just go to your Molina portal for that update. Next, what we will cover is some broker resources. These are going to be some tools available to you that will really benefit you. such as our new Molina benefits flyer. It is now available for you at our Molina marketing store. You'll use your MPN to log in. Every agent is able to order up to 50 materials, customizable, sent to them at no additional cost. We offer here the Molina benefit flyer. We also offer, what I'm going to show you next is going to be our brochures. So we have the brochures are available as well that you can customize. And again, up to 50 sent to you at no additional cost. We have our benefits at a glance. These will give you all of the state's high level plans and the benefits. Just again, it's benefits at a glance. So it's not everything in detail, just a high level overview, something you might want to keep out on your desk at the time of selling for quick referencing. This next slide is really going to be essential for you guys. It's probably it's going to be your probably greatest resource for us. We call it the cheat sheet, but it's really called the state fact sheet. This gives you a map of our footprint within the state, some high level overviews of what's happening in that state as far as benefits are concerned. And then most importantly, it has the list of all the hospitals and network by county for quick referencing. So you don't have to look up use the provider directory. You could print these out and have these easily available on your desk, which I recommend. Please note these are located in the Molina broker portal under docs and resources. Anything regarding training, state fact sheets, those will all be located there. Now, if you're looking for Molina Marketplace information for plans, SBCs, EOCs, drug formularies, this will be where you go to molinamarketplace.com to our resource hub. I would strongly recommend this, favorite this on your browser just for quick referencing. You're probably going to need it. Look, we're looking real competitive this year, so I think you're probably going to be selling us. At least we hope so. So put this at your resources so you got it for quick referencing, so you don't have to take time off to try to locate something for when someone has a specific question about a drug formulary or a specific benefit. Members also, all the member forms are located here as well. So again, another good resource, just stick it in that browser for quick referencing. These are our broker resources. We do have a broker support line here. We also have the new broker portal, account.evolvenxt.com. And then you can email broker support as well at mpbrokersupport@molinahealthcare.com. This next slide is going to be very important. Why is this one so important? Because if you haven't done everything needed on this slide, you don't get paid. Very important. So you're doing the right thing first and foremost by being at these trainings. Please make sure you complete any CMS required SBE or FFM certifications. Make sure you do access the Molina broker portal. You're going to navigate to My Credentials and select My Sales State. This is where you're going to review all your declared states and ensure that all the states you intend to sell in are active and current. So please, please, I cannot stress this enough, that you are set up, because if you write a policy and then 2-3 months down the road, we realize that it was not, you weren't active, and you come to me and say, oh, well, here's I just got the license. We will not be able to pay you the commission. So please make sure you are set up and ready to sell in all states that you are interested in. Next, I'm going to briefly just go over our broker portal. We do regular trainings as well as once on the broker portal and you're in the docs and resources. We also have the training guide for the broker portal. So if you have any specific questions, you probably could find the answer there. Excuse me. So to access the broker portal, you are going to go to evolve.nxt. Sorry, we just want to go back one slide. Thank you. You could go to evolvenxt.com. Here, you'll be able to log in using your email, or if you want to go to molinamarketplace.com, you'll click on the brokers tab at the top, and then from the drop down on the left, you'll select broker portal, and that will automatically redirect you. So one of the functionalities once you're in the broker portal is going to be your book of business search. Here you have the ability to search by effective date, paid through date, net due amount, pending termination date, and then you also have the ability to export and download and export that report if needed. So these are some of the member support functionalities, and that's going to be the ID card request and PCP change request. So you would simply select the ID card or PCP and ID card PCP changes. You'll click create case, and then from the drop down, you'll select either member ID card request or PCP change. Once you submit this request, you don't have to do anything more. We will process everything on our side. Okay, briefly, just going to put these up here for a minute. I'm not going to read all of them, but I know things have gotten a little bit crazy with the AOR switches, so we just want to remind our agents of our best practices, of what we expect. And so whenever you have a moment, just take some time and review these. And that concludes today's presentation. I would like to
Yeah,
thank everybody. I just want to mention this is another great page you might want to print out at your desk just for quick referencing. We discovered QR codes this year, so we put them everywhere. And yeah, thank you guys. I'm really excited. Again, I think Molina is going to be really, really hot. Florida is already, from what I can see, we're looking extremely competitive in most counties. We don't have referrals down here, so a lot of opportunity. I'm very excited. Does anybody have any questions?
yeah, that's perfect. I'm sure they do. And again, Lindsay, thank you so much. That was a ton of information. It does sound like Molina is going to be a great choice for a lot of people. Michelle, Sarah, any questions out there for Lindsay?
Thank you, Vince. We have a few questions. With the CMS changes, the 3-week calls, and things of that nature, what sort of unexpected things are you seeing, and what are the best ways to handle them as they come up?
I would say what we're seeing is more on the agent side, and that's just been with call times and hold times. I would say right now, more than anything, time management is going to be key because you don't know what type of agent or how long that call will be with CMS. We don't have control over that. And I mean, it really hasn't impacted us directly on our side, but we are expecting there's going to be some delays. We do expect it's going to make writing business a little bit more challenging when those calls have to occur and that those calls do last longer than 10 minutes or so. Maybe they could be 30, 40 minutes. So I think that's going to be the challenge. And then, our advice back would just be try to be as efficient as you can with your business and your time this year.
That's great. Michelle, Sarah, any other questions? Thank you, Lindsay.
Can you expand a little more on the rewards, the gift cards, and who qualifies for them?
Certainly. So the Molina Healthy Rewards, that is our member wellness incentive program. So all members on the plan 18 and over are eligible for the benefit. The Molina Healthy Rewards program, this offers a variety of wellness programs to the members. So these are just a few of the different programs that are available to help members engage and manage their health and wellness better. The gift card, again, that will automatically get sent to their My Molina portal once they complete the wellness assessment that's also located in their Molina portal, and then they complete that PCP. They do not need to notify us that they've completed their PCP. We will automatically uh, update that on our side. The gift cards, we have over 200 vendors that we work with. I can provide you a list of vendors. I don't know many offhand, but I know like PetSmart's on there. And the big one for us this year is that we did add the Visa gift card. And then again, those gift card comes in $50 increments, meaning that they'll get all $200 at once, but it's broken up into $50 allotments, allowing them to split it between multiple vendors if they choose so.
What is a single thing that AOBG and our agents and agency partners do to make things better?
What can they do? I would say one of the big things is going to be making sure that you take that extra time to give the members the 30-second to 60-second spiel about the member self-servicing options through the My Molina portal. That's going to cut down on so much servicing requests that they call you for. Hey, I need to find a doctor. Oh, where's my ID card? Oh, I need this form. All of that. That would be um, my biggest thing that I think would really is going to be valuable to your agents in writing is just spending that 30 to 60 seconds to explain and set members up on how to be self-servicing with some of our tools through the My Molina portal.
Excellent. Wonderful. Okay. If nothing else, Sarah, Michelle, is there any other questions?
Yeah, there's just one last one. I think it's just more of a verification. Is there a copay or out-of-pocket cost for the teledoc services?
Yes, the same as a PCP visit.
Much.
Okay. Perfect.
Depending,
Perfect.
that just depends on what plan they're on, obviously.
Sure, sure. Plans have different benefits. Obviously, look at the details there. And again, Lindsay, thank you so much. Thank you for being flexible too. I know I popped you on a little early. We really appreciate that. We're obviously running a little bit more quicker than we thought. So I appreciate you being flexible in that and jumping on as quickly as you did. And then again, the amount of detail and information that you provided, I'm sure, is going to be extremely valuable to our agents. So thank you very much for being here today.
Thank you for having me, and let's make it a great year.
Let's do it. Let's do it. I agree with that.